Welcome to Medicus Aeternus, where the journey to mastering medicine never ends. We are here to make learning easier, more enjoyable, and to help you excel in your medical path. If this is your first time watching our video, don't forget to subscribe, like, and share it with your friends. Let's dive in and learn something new. In this video, we will discuss anti-asthmatic drug. Before, let's have a brief recap about asthma. What is asthma? Asthma is a heterogeneous disease in which there is a bronchoconstriction, which leads to wheezing, chest tightness, and difficulty in breathing. There are several drugs that can help alleviate this condition and help in the management. So let's go on. The first group of drugs, they are bronchodilators, and their mechanism of action leads to the dilatation of the bronchi. The first group we have here in front of us is beta-2 agonists. Their main mechanism of action is acting on the beta-2 receptors, leading to bronchodilation. And there are many types. We have salbutamol, which is a short-acting, and salmeterol, which is a long-acting, and also the other types of drugs that you see here on the screen. In case of salbutamol and short-acting drugs, they dilate the bronchi for a short period of time, while salmeterol and its long-acting likes, they dilate the bronchi for a long-acting time. Mainly salbutamol, which is abbreviated as SABA, it's usually given as an alleviation of attack. It helps in the alleviation of the symptoms. It helps in the facilitation of breathing. The next type, we have phosphodiesterase inhibitors. These type of drugs, such as theophylline, they have two mechanisms of action. First, they act as the inhibitors of phosphodiesterase, and also they are antagonists for the adenosine A receptors. By this mechanism of action, they lead to the bronchodilation and facilitation of breathing. In case of acute severe attack of asthma, usually these kind of drugs, they are given intravenously. And in case of chronic asthma, as management for a long time, they are given in a low dose tablet. Their adverse effects, they can be some headaches, some irritability, tachycardia, and problem with the heart, like for instance, the arrhythmias. Here, the third type, we have antimuscarinic drugs, such as ipratropium bromide. These drugs, they act on the muscarinic receptors. They block their action, and by blocking their action, acetylcholinesterase, which is the main neurotransmitter in the parasympathetic nervous system, doesn't work, which leads to bronchodilation and facilitation of breathing. Next, we have the main milestone of treatment of asthma, anti-inflammatory drugs, which are also known as corticosteroids. These drugs are the background of any treatment regime of asthma. And these drugs, such as hydrocortisone, prednisolone, beclomethasone, and so on. Their mechanism of action is widely known. They act as the inhibitors of phospholase A2, and by this they block the main pathway of the inflammation, leads to less cytokines, and which will lead to a bronchodilation. They have myriads of mechanisms of action, such as they inhibit beta cell function, they inhibit T cell functions, they inhibit macrophages, mast cells, and so on. In case of acute attack, usually hydrocortisone is the medicine of choice, and in case of chronic as management, we give prednisolone. Next, we have mast cell stabilizers. Mast cells are one of the cells in the immune system, and they are fairly responsible in the pathogenetic pathway of the asthma. By giving these drugs, you might inhibit mast cell degradation, but it is important to note that the main mechanism of action of this group of drugs is still fairly unknown. And example of the drugs, ketotifen, cromolyn sodium, and so on. Next, we have Leukotriene Antagonist, which are very, very strong drugs, and they are very helpful because one of the main cytokines in the development of asthma is leukotriene. And by giving these drugs, blocking the action of leukotriene, it helps too much in the patient, such as montelukast, zafirolukast, and so on. Then we have Lipo oxygenase inhibitors, such as xylitol. These type of drugs, they decrease the synthesis of leukotriene, and by doing so, they decrease the pathogenetic pathway, they decrease the bronchoconstriction of the bronchi, and they help in breathing. Their adverse effects, irritation of the throat, chest tightness, and so on. Thank you for watching Medicus Aeternus. Remember, the journey of medical profession is eternal, and we are here to guide you every step of the way. Make sure to watch our other videos, don't forget to subscribe, hit that bell for updates, and show some love by liking and sharing this video with your friends. Stay awesome, keep learning and thriving.